This is my working place, Evercare Hospital, Dhaka. All of you know what is osteoporosis, and the main problem of osteoporosis is weak bone that breaks easily and increase the risk of fractures. And this is called fragility fractures, the fractures that results from mechanical forces that would not ordinarily result in a fracture. In other words, the fracture that occurs from a fall from standing height or less, or if someone lifts something of lightweight and sustain a fractures. Using the data of World Health Organizations, Keynes et al. Published in 2008 that 6.3% of men and 2.1% of women over the age of 50 globally has osteoporosis. And based on the world populations, the total 500 million men and women worldwide may be affected with osteoporosis. This is the just published data by Keynes et al. In the Archive of Osteoporosis. This is the project of scope by International Osteoporosis Foundations, a 25.5 a 25.5 million women and 6.5 million men, a total 32 million people are affected with osteoporosis in Europe. And in Asia, there is no exact data from the different countries due to prevalence of osteoporosis, because in many countries they don't have data, and also in some countries, highly populated countries like China and India, 60% people lives in the rural area where there is less facilities of diagnosis of osteoporosis. But you can see here the Asia Pacific audit, and they're giving the epidemiology and burden of osteoporosis in 2013. And they said that overall populations will grow up 24% between 2013 to 2050. And you see here, the percentage of population over 50 years or over from 2013 to 2050 will 144%. So they assume that from the 71 Asian Pacific countries, 119 million people aged 50 years and over are projected to be at high risk of fracture by 2040. It is published in 2006 by Canis in 2050 that 1 in 3 female and 1 in 5 male aged over 50 years will suffer an osteoporotic fractures, and about 8.9 million fractures annually, that is 1 fracture every 3 seconds. And these fractures, 51% from Europe and America and 49% from Western Pacific and Southeast Asia. And they calculated that only the hip fracture increased from 1990 to 2020.
Sorry, ladies and gentlemen. I think there's some technical glitch here, most likely because of the signal. And the team, yes, I think the Prof side trying to connect in again.
Yeah, we can wait for him to connect back.
Sure. Prof side, you're muted.
Can you see me now?
Yes.
Yes, sorry. So I have to go the screen share again.
Sure.
So now, which one is?
Yes, can see now. Clear.
This clear. So I have to go. I have opened 2.1. This is.
Yeah, Prof, you can go ahead. Yes.
Okay. This is the last slide. That approximately 55.3 billion euro has been spent in Europe during 2019. And you can see here in the bottom that about 4.3 million fragility fractures in 2019 in Europe, and 5.34 million will be in 2034. That is an annual increase of 24.8 million. 24.8%. And among the new fragility fractures, hip fractures, vertebral fractures, and forearm fractures constitute 50%, and the other fractures also 50%. So you should consider the other fractures also. But in America, where from the 10 million Americans of osteoporosis, there is 2 million fractures every year, and there is a 60% of fracture involving the vertebra, wrist, and hip fractures. And their direct cost was 17 billion. But in fragility fracture burden in Asia Pacific, there is no specific data. I have said already, there is 319 million people aged 50 years from Asia Pacific are projected to be at a high risk of fragility fracture by 2040. And about 50% of all fractures in the world will occur in Asia by 2050. You see here, this is a 20 years back published this data that risk of subsequent fractures after initial vertebral fracture. You see clinical vertebral fracture, there is risk about 12-fold, and hip fracture more than 2-fold, and distal forearm fractures 1.6-fold, and also there is a chance of pelvis fracture, clavicular, sternum, and rib fractures. And the same publishers in 1919, they published this data also, that after 1 year of having a index fracture, 20% chance of fracture within 1 year of men and female, and male has 17.5% chance of fracture within 1 year. And a prior fracture is associated with 86% increase in another fracture. So this is very important slide, just published. The treatment gap in European countries in 2019. You can see, despite the all availability of screening, diagnosis, and treatment facilities in Europe, many countries have very high moderate treatment gap. That is about 80% of people who have had at least one osteoporotic fractures are neither identified nor treated for osteoporosis. And in other words, from the vertebral fractures, only 2/3 of the fractures are not coming to us for clinical attention. Only 1/3 is coming to the clinician for their treatment. And treatment gaps in osteoporosis, these are the contributors of the treatment gap osteoporosis regarding the case finding and management, public awareness, and government and healthcare system issues. Most important is that despite the all facilities in Europe, you see there secondary fracture prevention is the very important gap. The National Osteoporosis Foundation published this, that the time is now to diagnose and treat this silent killer responsible for 2 million fractures in America, cost about 52 billion in 2018. And the expert predict that the osteoporosis will be responsible for over 3.2 million fractures annually over the next 22 years within 2040. And the cost will be increased from 52 billion to 87 billion. And already I have said previously that there is a 56.9 billion cost in Europe. And if you consider in Asia, only Asia, hip fracture, it is 9.5 billion in 2018 and will be increased 15 billion in 2050. So you see here, the fragility fracture is a disability burden in Europe, after the ischemic heart disease being the first and fragility fractures being the fourth disability in Europe among the non-communicable disease. And this is very important slide to me. This also published in 2020 that lifetime risks of fragility fracture from the age of 50 years equivalent to lifetime risk of cardiovascular disease in these 6 European countries like France, Germany, Italy, Spain, Sweden, and United Kingdom. And in other side, only the lifetime risk of only hip fracture from the age of 50 years, it is the equivalent risk of stroke in Europe. So it is published in 2002 by Canis and then said the combined lifetime risk for fragility fracture is 40%, which is equivalent to the risk for the cardiovascular disease. This is the important slide also to me. This is published by American Society for Bone and Mineral Research. And they say the annual hip fracture in America is 258,000. Heart attack is huge, 720,000, and the invasive breast cancer is 230,000. But I am interested in this slide that only 10% of the individuals having heart attack usually die within 1 year. That is 1 year mortality 10%. You can see in breast cancer, 1 year mortality is 20%, but in hip fracture, 1 year mortality is 25%. If we calculate from this, the annual death due to heart attack is 72,000 and breast cancer 46,000, and in hip fracture, only hip fracture, some portion of burden of osteoporosis is 64,000. This is another slide you can see here. The lifetime risk of a fracture of a 50-year-old lady have 50%. In other hand, breast cancer is only 12%. So there are many awareness programs, many screening program, and many treatment programs for heart attack and breast cancer. But sincerely speaking, there is little program, especially there is no program in Asia for hip fracture, for the assessment of hip fractures and other fragility fractures. So I want to draw attention of this learned participant in this slide. This is a burden. This is published in 2007 and 2018 by the Journal of Bone and Mineral Research, American Heart Association, and American Cancer Society. If you calculate the incidence of annual incidence of breast cancer, stroke, heart attack, this is less than 1 million. But osteoporotic fracture in America is 2 million annually. So this is a huge burden of osteoporosis and fragility fracture. The orthopedic surgeons are trying their best and giving the most modern treatments for the hip fractures. But the story is not end here. You can see this post-operative good-looking X-ray. But the history, other history is 25% will die after first year of hip fracture, despite the giving up all modern treatment. And profound loss of function, including 40% unable to work independently, 60% require assistance, and 10 to 20 or up to 30% require long-term nursing care, and they remain in nursing home and unable to return back to their home. And there is a double risk of sustaining another fractures. And the same thing is in case of spine fracture. Most common fractures, and one fracture occurs in every 22 seconds, occur during normal day-to-day life activities, and even in 30% of vertebral compression fractures occur while the patient is in bed. And a 50-year woman has an 16% lifetime risk of fractures, and 2/3 of the fractures are not clinically recognized. So spine fragility fractures significance lead to back pain, deformities, loss of height, poor mobility, reduced respiratory functions, distorted body image, and depressions of the patient, and associated with 8-fold increase in mortality and a 1 in 4 chance of another fracture during next 5 years. So my take-home message is, recognize the burden of osteoporosis and fragility fractures. There is the increased rate of fragility fractures in every year, and there is a high rate of recurrent fractures also. The fractures are associated with profound functional loss and mortality risk, and timely screening, treatment, and fracture prevention is important. Sincerely speaking, current practice of screening, treatment, and fracture preventions are not sufficient. Love your bone, protect your futures. Thanks for patient hearing.